Good evening. My name is Julia Lewis, and I am presenting to you a brief history of healthcare in the United States because understanding where we came from will help us prepare for the future. Colonial Americans relied on medieval concepts of the human body to treat disease. Anyone could claim to be a doctor, whether or not they had any formal medical training. Treatments such as bleeding, blistering, and purging were often used. A popular practice was to bleed a patient until they were unconscious, then dose them with mercurous chloride until salivation began. Native Americans, on the other hand, used natural remedies such as plants and herbs, and other holistic treatments. Many of the plants and herbs the Native Americans used became foundations for modern pharmaceuticals. In the 1970s, the Pennsylvania Hospital was established. This was the nation's first mental hospital. In 1765, the nation's first medical school was chartered in Philadelphia. By the time of the American Revolution, there were 3,500 to 4,000 physicians in the country. Roughly 400 of those had formal training, and only half of those held a medical degree. In 1789, President John Adams signed the Marine Hospital Fund into law. This was one of the first signs of medical organization in the United States. The law provided medical care for ill and disabled seamen in the U.S., including merchant marine and Coast Guard members, as well as other federal beneficiaries at several hospitals located at sea and river ports. The plan was funded by deductions from the seamen's salaries. These hospitals not only provided care for the ill and injured, but helped curb the spread of diseases entering the ports of the United States. By the time of the outbreak of the Civil War, there were 27 marine hospitals in the country. After the Civil War, President Ulysses S. Grant moved operations of the Marine Hospital to the Military Department. In 1847, the American Medical Association was founded and developed preliminary education standards for the degree of MD and published the AMA Code of Medical Ethics. In 1850, the first accident insurance policy was written to cover bodily injury due to railway or steamboat accident. The Civil War led to better treatment of wounds and infection and an increase in hospitals. Between 1870 and 1899, companies in industries such as mining, lumber, and railroads developed group industrial clinics that prepaid doctors a fixed monthly fee to provide medical care to employees for illness or industrial accidents. As the first supervising surgeon, Dr. John Maynard Woodworth took charge of the Marine Hospital Service in 1871 and served in that post until 1879. Based on his experience during Civil War, Dr. Woodworth adopted new standards of hygiene, set up decontamination procedures, standardized medications, and established nutritional regimes. Dr. Woodworth was a founder of the American Public Health Association in 1872. Many of today's modern health programs, such as Public Health Service, National Institutes of Health, the Centers for Disease Control and Prevention, and Indian Health Services, can trace their origins to the Marine Hospital. By 1900, the life expectancy in the United States was 47 years. Between 1900 and 1909, hospitals began charging for services. Nearly all hospitals were nonprofit and run by religious groups or funded by wealthy donors. In the 1900s, hospitals became places where the latest technology was available, surgical techniques produced good outcomes, and medical students and interns were educated and trained. Medical standards rose in the early 20th century, in part due to the efforts of the AMA. In 1904, the AMA formed the Council on Medical Education to standardize the requirements for obtaining an MD. In 1905, the AMA established the Council on Pharmacy and Chemistry in an effort to set standards for drug manufacturing and advertising and to fight the war on quack patent medicines and nostrum trade. In 1902, Maryland was the first state to enact workmen's compensation law. However, it was declared unconstitutional in 1904. In 1908, the federal government established workmen's compensation for its civilian employees. In 1910, the AMA bands together half of the nation's 140,000 physicians. In 1912, insurance issues gained public attention when Theodore Roosevelt and his Progressive Party campaigned on the issue of health insurance for industry. He proposed national health insurance as one of the major planks in his campaign. This was the first call for a national health plan. Also in 1912, the National Convention of Insurance Commissioners developed the first model of state law regulating health insurance, and the American College of Surgeons is founded to set standards for hospital accreditation. In 1915, the American Association for Labor Legislation also publishes and promotes a draft bill calling for compulsory health insurance, but the efforts were derailed when the United States entered World War I in 1917. The initiative was supported by the AMA in the beginning, but by 1920 they reversed their support. Between 1915 and 1916, several states offered bills for universal health insurance. All were defeated by insurance companies, the AMA, pharmacists, and unions. In the years between 1920 and 1929, medicine is seen as a science. Demand for care increases, hospitals are accepted as treatment centers, the number of well-trained physicians increases, and inadequate medical schools are shut down. However, medical care costs rise. In 1927, President Calvin Coolidge convenes a committee to address the growing problem of access and cost of health care. He was the first U.S. president to use the word crisis when referring to health care. In 1929, as the Great Depression loomed on the horizon, healthcare spending in the United States averaged 14% of the average American family income. Also in 1929, the Los Angeles Department of Water and Power set up a clinic to provide its employees with health care at a set rate, becoming the first health maintenance organization. That same year, Baylor University Hospital in Dallas, Texas, created a group plan that offered prepaid hospitalization to school teachers. And in 1929, the American Hospital Association was created to organize community hospitals with each other in order to offer hospital coverage and reduce competition. This led to the formation of Blue Cross. In 1932, Blue Cross Sacramento, California created an insurance plan that offered free choice of doctors and hospitals and reimbursed for the care of low-income patients. California state legislation allowed Blue Cross to act as a nonprofit corporation, which made them free from taxes and insurance regulations. The Blue Cross plan expanded to dozens of states where similar laws existed. In 1934, President Franklin Roosevelt presents Social Security legislation to Congress. However, due to the pressure he received from the AMA, businesses, and the insurance industry, the proposal no longer contained the national health insurance plan that Roosevelt had intended. This was the nation's second failed attempt to create national health insurance. The Social Security Act was passed in 1935, enabling states to raise revenue to care for the elderly and to provide for the disabled, maternal and child welfare, public health, workmen's, and unemployment compensation. In 1939, physicians organized the first Blue Shield plans to cover the cost of physician care, and the Department of Health and Human Services was created, known then as the Federal Security Agency, to bring together all federal agencies concerned with health, welfare, and social insurance. In his 1944 State of the Union address, President Franklin Roosevelt outlined his Economic Bill of Rights, which included, and I quote, "the right to adequate protection from the economic fears of old age, sickness, accident, and unemployment," end quote. In an effort to attract employees during the government-imposed wage controls of World War II, businesses began offering health benefits as incentives. In 1945, President Truman proposed federal universal coverage as part of Social Security. In 1946, the Hill-Burton Act, Hospital Survey and Construction Act, was passed, requiring all hospitals receiving federal funds to end discrimination and offer free care to the uninsured or those unable to pay. In 1946, after soldiers returned from World War II, U.S. births were up to 3.4 million, from 2.8 million in 1945, marking the beginning of the baby boom. In 1949, Truman's health care bill, the fourth attempt at national health reform, was defeated in the House of Representatives due to opposition from doctors and insurance companies. The AMA warned that the plan was socialized medicine. By 1950, the number of insured persons in the United States tops 190 million, up from 20.7 million in 1950. And the national health care expenditures are $12.7 billion, 4.5% of the gross national product. Due to pressures from the AMA, many states banned group practices with prepaid monthly fees in favor of fee-for-service plans. In 1951, because the commercial carriers are allowed to charge lower premiums to healthy people, they gain a greater share of the insurance market, overtaking the nonprofit Blue Cross Blue Shield. In 1954, the U.S. government showed support for employer health insurance when Congress made employer health benefits a part of tax-free income. The mid-1950s showed major advances in medical science with the first successful organ transplant and the development of a polio vaccine. By 1958, 75% of Americans had some kind of health insurance. Between 1960 and 1970, healthcare spending increases due to the growth of expensive medications, specialty care, and for-profit hospitals. Healthcare spending is $27 billion, 5.1% of GNP. Medical school enrollment doubles during this time, and the number of doctors choosing full-time specialties increases, along with salaries of the average physician. During this time, there are over 700 insurance companies in the United States. In 1961 to 1962, President Kennedy pushed for elderly health insurance funded through Social Security taxes. This fifth attempt at national health reform was supported by 69% of the public, but was defeated in Congress because of lobbying by the AMA, business, pharmaceutical, and insurance companies. In 1963 to 1964, President Lyndon Johnson declared war on poverty and proposed the sixth attempt at national health reform when he devised an elderly health plan that would reimburse hospitals for the cost of services and pay usual and customary fee-for-service to doctors. By 1965, while 70% of the nation's population had hospital insurance through employer-based plans or private companies, more than half of senior citizens had no coverage. In 1965, Congress passed Medicare, which under Title 18 of the Social Security Act guaranteed access to health insurance for Americans over the age of 65 years, regardless of income or medical history. Medicaid was a part of the Social Security Amendment of 1965, Title 19, and was funded by both state and federal governments to provide care for low-income Americans, including children, pregnant women, parents of eligible children, people with disabilities, and the elderly needing nursing home care. By 1966, while many doctors refused to participate in the Medicaid program, earnings rose 11% under Medicare. In 1969, President Richard Nixon announces the nation is facing a massive health care crisis brought on by increased health care costs caused by the growth in medical technology and medicine, the increase in for-profit hospitals, Medicare spending, and economic inflation. In 1971, President Nixon initiates a war on cancer, supporting medical advances. AMA membership dropped to one-half of the nation's doctors after dissatisfaction with previous legislation. In 1973, Congress passed Nixon's Health Maintenance Organization Act, which provided managed care through a network of providers at set rates rather than fee-for-service, and created HMOs with federal oversight of funding for nonprofit organizations. With a goal of enrolling 90% of the population, this seventh attempt at national health reform was supported by Congress, insurance companies, doctors, and hospitals. Enrollment in HMOs, however, was slow, and by 1980 only 10 million were enrolled. President Carter signed Congress's Revenue Act in 1979. This act established flexible benefit plans, which approved health savings accounts and gave employees the ability to set aside pre-tax dollars to pay for medical expenses in flexible spending accounts. Medical science advanced in the 1970s, and the World Health Organization, WHO, eradicated smallpox in 1979. By 1980, healthcare spending was 3 times higher than in 1970, reaching $257 billion, about 10% of the gross domestic product. The 1980s proved to be a decade of increased privatization of healthcare as corporate systems began buying up regional hospitals. Congress passed the Bayh-Dole Act in 1980, which expanded privatization of university research, allowing drug companies, universities, and biotech firms to benefit from taxpayer funds for research. In 1982, as a cluster of symptoms and syndromes became increasingly common, the Centers for Disease Control officially defined it as AIDS, anti-immune deficiency syndrome. In 1983, President Ronald Reagan curtails Medicare fee-for-service reimbursement and changes to a diagnosis-related group payment system. DRGs are a way of classifying patients by their diagnosis, average length of stay in a hospital, and usual therapies received. Providers are paid a lump sum based on the calculated DRG. By 1984, 41% of HMOs are nonprofit, which is down from 88% in 1981. In 1988, 3/4 of working Americans covered with employer-sponsored health insurance have a fee-for-service plan, allowing them to choose any provider and submit bills for reimbursement up to a set percent with no questions asked after meeting their deductible. By 1990, healthcare costs were rising at twice the rate of inflation. This growth was slowed briefly by the emergence of managed care and its third-party pre-approval requirements for all treatment, incentives to physicians for not referring to specialists, utilization reviews of medical practices, and enforced hospital discounts. In 1990, the Human Genome Project was created. In 1991, participation in managed care reaches 33% of those enrolled in health care. 17% of those were enrolled in HMO, and 16% were enrolled in fee-for-service PPOs, preferred provider organizations, whose popularity grew because they offered more flexibility by providing out-of-network benefits. President Clinton proposed a national insurance health security plan in 1993, which would enroll all citizens in health insurance through government-run regional alliances that would have the power to regulate costs and quality of managed care. This was the 8th attempt at national health reform, but was defeated in Congress in 1996 due to lobbying by pharmaceuticals, insurance companies, and the AMA. In 1997, the Food and Drug Administration, FDA, created rules to allow drug companies to advertise directly to consumers as long as the ads balance supposed benefits with possible risks. By 1998, traditional fee-for-service insurance plan enrollment had dropped to 14% of the health insurance market, while HMO enrollment increased to 35%. By 2000, the life expectancy in the United States is 77 years of age. Medicare and Medicaid account for 32% of all healthcare spending. National healthcare spending is $5,267 per person, $1,821 more than Switzerland, the next runner-up. In 2003, President G.W. Bush signed the Medicare Prescription Drug Improvement and Modernization Act, which offered prescription drug coverage to seniors and people with disabilities starting in 2006. The act also created Medicare Advantage, which allows for health savings accounts and increased subsidies to insurers that offer private Medicare plans. By 2004, the cost to provide employee benefits is eating into profits of manufacturers. General Motors was paying $1,400 per vehicle manufactured in health benefits, while only making $178 in profit per vehicle. Small businesses reported healthcare costs as their number one problem. The National Coalition on Healthcare, chaired by former presidents Ford, Carter, and Bush, called for health care price controls and national health insurance. By 2005, healthcare spending nears $2 trillion, more than 16% of the gross domestic product. More people lack health insurance as fewer businesses offer it in order to hold down their costs. 55% of companies with less than 200 employees even offer health insurance. The number of uninsured is up more than 6 million, even though 1 in 3 of these uninsured households have an annual salary of more than $40,000. At the same time, those with insurance coverage struggle to deal with their portion of medical bills. The Democratic representative from Michigan, John Conyers, introduced the Expanded and Improved Medicare for All Act, H.R. 676, in 2005 in an effort to provide comprehensive health insurance coverage for all U.S. residents. This was the 9th attempt at national health reform. President Bush, in his 2006 State of the Union address, proposed that citizens pay taxes on their employer-provided health care benefits. This would presumably pave the way for increased demand for tax-protected health savings accounts with higher insurance deductibles, leading to the complete privatization of health care. This was the 10th attempt at national health reform. In 2009, President Obama established the Office of Health Reform to coordinate efforts on national health reform. That same year, the American Reinvestment and Recovery Act, ARRA, made substantial investments to help develop health information technology, expand the primary care workforce, and conduct comparative effectiveness research. On March 23, 2010, President Obama signed the Patient Protection and Affordable Care Act, PPACA, into law. The act, also known as the ACA and Obamacare, required that all individuals have health insurance beginning in 2014. The law included expanding Medicaid to cover the poor, the ability for people who did not have access to affordable coverage through employment to purchase coverage with federal subsidies through American Health Benefit Exchanges, penalties for large businesses who do not offer health benefits, and separate exchanges for small businesses to purchase health plans. The Act also mandates that health plans cannot deny coverage to any person for any reason, including their health status, nor can they charge more because of a person's health or gender. Young persons are able to remain covered on their parents' plan until age 26. In 2011, the first baby boomers reached age 65. And PricewaterhouseCoopers predicts healthcare spending will reach 21% of the gross domestic product by the year 2020.